1:30. We'll call the meeting in order. Please stand for the Pledge of Allegiance. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
These meetings are being recorded for the sole purpose of preparing accurate written minutes. Recordings are overwritten following approval of minutes, eliminating unofficial records of these proceedings. So we have number 3 as a guest to address the prison board. I'm going to skip over that because I think we don't have a real need for, from what I got from the warden, for any executive session. So I think it would be in our best interest to get rid of what we have on our agenda and go through it fairly quickly, and then we could address the other issues. All right, so let's have everybody had a copy of the minutes of the meeting held, regular meeting of August 21st, 2024. So is there a motion to approve those minutes?
So moved. Second.
Motion made second. All those in favor say aye.
Aye.
Any opposed? That motion carries. No, there was an executive session held, but we announced that when we came out of it at the meeting that we were at on August 21st, 2024, as reflected in the minutes. Committee reports, maintenance report. Ronnie?
We had Johnson Controller to reboot one of the panels and some other cameras. Submitted the monthly dweller reports to DEP. We replaced the indoor filters at the animal shelter. We changed out a couple lights in the rec yards to LED lights. Met with Carbon Engineering. They're working on the Well 2 project, and we went over some things for the emergency response plan for the pump house. I worked with Keystone Fire and Safety. They were remoted in order to fix an issue with the doors. We recently did some work on lists and inventories for Department of Corrections. Johnson Control had an emergency project, so they haven't been there the last couple of weeks to continue rebooting, but they're scheduled to be here tomorrow. As of, I had text back and forth with Aiden this morning. If he doesn't show up, I will get a hold of him.
I talked to him today. He's
Yeah.
supposed to be there tomorrow, and he said there's only about a dozen,
We have 2 panels pretty much.
Cameras
developed,
that
maybe
have to.
1 or 2 others.
so we're close.
Yeah. And then, just one thing that didn't make it to the list, we had Johnson Control there yesterday. We replaced 3 smoke detectors and 1 heat detector.
Okay, does anybody have any questions for Rodney on the maintenance report? No questions? Then we'll move on to the next item. Thank you, Rodney. Work release report.
Good afternoon, everyone. Submitted to the board is the monthly work release report. For the month, we had 2 individuals on the program, with 1 currently on the program. The disbursement of the net income will be as follows. The net was $1,524.98. The breakdown would be room and board $700, court costs $100, inmate payments were $694.98, and escrow $30. Also included is the monthly in-house report, and if there's any questions, I could try to answer those.
Everybody have a chance to review the work release and the in-house report? Any questions for Mr. Schubeck? There being none, we'll move to the Plan of Action Committee.
Yes, I have comments on that, but I'd like to save that for executive session after we take care of everything else.
It'll be really short. Okay, we'll move on to the warden's report.
Okay, warden report from August 1st to August 31st of 2024. We had 67 male admissions and 11 female admissions for the time period, with 63 male releases and 19 female releases. Average daily population for that span was 137 inmates. Total as of August 31st was 111 males, 20 females, for a total of 131. Total admissions as of 8/31/24 was 641. Transports, we had 3 hospital runs, 1 orthopedic run, 6 specialists. For 10 days, we had no hospital duty. That completes my report.
Does anybody have any questions on the warden, for the warden on the warden's report? No questions, and I'll entertain a motion to accept the warden's report.
Motion.
Motion made by Den, is there a second? All those in favor say aye.
Aye.
Any opposed? executive session we're gonna take at the end of the meeting, that's gonna be on, Plan of Action Committee, report, and, it's, related to security at the prison. Okay, personnel report. Is there a motion to approve the personnel report?
Motion to approve.
Motion made by Wayne, second.
Second.
Second by Dan. Any questions on personnel report of the motion? No questions, all those in favor say aye.
Aye.
Any opposed? That motion carries. Is there any old business? There being no old business, we'll move on to new business. Oasis Commissary Automatic Annual Renewal. Bob, is there an action we have to take on that? Or is it just on here under new business that it's automatically being
Yeah,
renewed?
it's for the commissioners, I think it's just informational.
Yes.
That's not attached to this, is it?
It's
I
the
think I
last
saw it.
page.
Oh. Oh, Rocky isn't here. We haven't been up there to check on the food.
It's not the food market, it's the commissary.
Alright,
Prison
well, we
storage.
still haven't been out there for that, okay, alright. Nothing, is there a motion then to recommend the automatic renewal? Do you recommend,
We do it every year.
and we'll recommend the commissioners execute the automatic renewal, we'll need a motion to that effect.
Motion.
Motion made, is there a second?
Second.
All those in favor say aye.
Aye.
Any opposed? That motion carries. Ion scanner training, October 24th, 2024. How many do you have?
They allotted us 10, so we'll train 10 other staff members in use of the ion scanner.
Okay.
It should take, I think it's a 6 to 8 hour course.
That's working well, Warden?
Yeah, it is.
Okay.
Any correspondence? Okay, with that, we'll go to, the hearing of guests. I had, requested via email for Carbon Monroe Pike to be here. I see, James Drake is here with other representatives of Carbon Monroe Pike. This, to give background to it, this comes about, I was told by, Tammy Record that Jamie had indicated to me that, there were not gonna be any furloughs to treatment from the prison. And I was concerned that, why Jamie didn't ask me that, or at least address it to the prison board or the appropriate individuals. And then as a result, I received an email that was sent to the prison board and everything from Mr. Sorrentino relating to the reasons why any furloughs, and, which raises my concern. Why, if it was something as significant as this? First of all, when did it become a problem? And secondly, why was it done in the manner that it was? If it was significant, why did you tell like Tammy to address it, or at least, try to either get with the prison board, or, as I indicated in my email, this is subject to, the public defender's office and the judges, in granting the furloughs. Why wasn't that done?
Okay, so let me go through and give you a little bit of introductions first of all, if everybody doesn't know who everybody is. So Chris Sorrentino is our case management supervisor who managed the inpatient funding. Carolee Boyer is our supervisor for the outpatient department. Robbie is assistant administrator, and Tammy is the case management supervisor. Lynn Daniels, who is the supervisor of Carolee, Tammy, and Chris is currently out on medical leave. So basically, the way things operate in our organization is, it came to my attention, I happened to be in a morning meeting where they were discussing it. It is Tammy's department that it came out of through Lauren, so that's why she was instructed to contact you initially. Chris is the person who manages our inpatient funding, so that's why he followed up with an email. And that's how that occurred. What happened is, when I was brought to my attention in the morning meeting that we had by Lauren, actually, that this was happening, we discussed that that is not our standard operating procedure that we do. And at that point, I initially reached out to Chief Holter just to ask who would be the most appropriate person to discuss this with. And we had a meeting which Robbie was at, and he can talk about what the response we got at that meeting was.
Yeah, we were told that it's basically the DA, they have nothing to do with it, the district attorney makes those decisions, so we need to reach out to him and talk to him about it.
So that's why when we send correspondence, that we send it to you, because that's where we were instructed that would be the appropriate person to go to. And both Chief Holter and Judge McKeever were at that meeting and said that you would be the person to be in touch with it.
Okay,
that's
so, we'll get back to this, so, then why did it happen the way it did? Why was it just an email directed, a directive basically, that you're not doing that? Why wasn't there no discussion? Why didn't anybody call me, request a meeting and say
Tammy
that's
did
not?
call you initially.
No, Tammy told me that you said to me that you were not doing furloughs anymore. There was no setup of a call. Why didn't you call me?
Because that's her department, she handles it, she has the specifics.
You're the director.
She has the specifics on how it works, what's going on, who Lauren was seeing,
Yeah, 'cause
okay?
Okay,
So,
are the furloughs, let me ask you
It's
this.
really not significant as to who called, she had the information, she
Well,
called you.
it is, because
it
the
isn't.
way, yeah, it is, because we got a directive that was just, these are the reasons, and this is what we're doing, with no discussion. That's not how this is supposed to work. We had a situation like this in the past, that I said, we need to come here, when unilaterally, there were allegations of fentanyl at the prison, and immediately, all counseling there stopped. There was no fentanyl at the prison, we dumped all the,
And
we
that's
had
not
the
true.
people
Counseling
come in.
Question, I have a question.
Yeah,
What is the
Is
problem?
this even a salary or a prison board issue? Shouldn't this be under an executive session? Because this appears to be an internal problem and procedural problem, and nothing to do with the decision of this prison board at this meeting. It sounds like, I don't want to get into a shouting match here. I think we got some communication issues, and I think it should be an executive session.
well, I don't think you can, and we could check with Bob, but executive sessions are for personnel matters,
But this apparently is
security, or, go ahead, I'm sorry.
I just feel that this is basically an internal problem, personnel issue on how things are being handled.
Well, if it came across as a part of a personnel matter for, first of all, it's not our personnel. But the second thing is, it's not directed as a personnel matter. I know there's a miscommunication, but I'm trying to establish, because it does affect, my next question was, would furloughs are a matter under our contract that we have to provide the services? They're not at all, the level of care, so you don't pay for the furloughs that come out of the prison.
Our purpose for being up there when it comes to Lauren is to do level of care assessments. What you are funding for Lauren is to do the level of care assessments and any of the case management to get that individual from point A to point B. It is not monies that are coming to us to pay for treatment. Furloughs, and the reason why my biggest concern with furloughs is that it interrupts the continuum of care. We have 2 individuals right now that are on furloughs from Carbon County Jail. One is being returned, I think, today because she completed treatment, and now she's going to go back to jail. She's recommended to IOP. We can only provide outpatient, so that's a disruption in continuum of care. We have another individual who will be returning back to the correctional facility, I think sometime next week, because he will be completing treatment.
Okay.
So the biggest concern that I have, and I noted this on our email, is that it seems that, and this is also from the discussions that I've had with Lauren, is that it seems like furloughs are being used in lieu of an appropriate home plan. We're sending these folks to inpatient treatment 3 months before they're supposed to complete their minimum dates on a level of care that oftentimes is well less than 3 months. And then they end up being returned back to the jail. They're going back to an environment that is not conducive to the recovery, because they're surrounded by individuals who are just about as sick as that individual was when they left the jail. And there is a huge disruption in terms of their recovery because of this. What we have done in the other 2 counties is when an individual is looking at a furlough, we look to furlough them within 30 days of their minimum date. That way that individual can complete treatment, and if they do complete treatment and they can be paroled after that, then they can go to their, through the continuum of care that's recommended.
Okay, but even with a continuum of care, we've had situations where someone will come out of inpatient treatment. The recommendation then would be because of outpatient treatment, that would be the next step, as you indicated, that's one step down.
Or partial.
But because of their work environment, because they may have a job, they're not able to do it, and then they would step down one to just outpatient treatment. That happens all the time, doesn't it?
It happens if it's appropriate. There are other individuals that when they cannot meet that 9 hours minimum for IOP, that they are sometimes discharged because they are not able to follow through with that.
Okay, but we're dealing with a situation that, were both of these in lieu, because that's how your email, and I didn't get through everything with Jamie, but your email seemed to indicate that that was a pattern that we were using to circumvent some sort of home study treatment. Are both of those cases dealing with an individual who wasn't eligible for parole, and are you aware which judges it was in front of? Because you said several, or is that just the two that were there?
In terms of the two that are coming back, I do know one was because there was no appropriate home plan for him, and so it was furlough him.
So,
Can I say something? I do the paroles,
Mhm.
right? 9 out of 10 paroles. Lauren will tell you, I don't parole people to rehabs, right? Why can't I do that? Because you get furloughed or paroled to a rehab, where do you go afterwards?
What do you mean?
Okay. I parole somebody to a rehab, that was
Right.
brought up. We parole people in lieu of home plans. I never parole anybody to a rehab, ever. Because I parole you to rehab, where are you going afterwards?
Well, it depends what their home plan is, right?
You need a home plan. A home plan
Right.
is having something prior to release.
Exactly.
So,
and that's-
just hear me out. I've done this 36 years. I don't like argumentative with you. I'm just telling you the way things work,
right.
right? You need a residence to get paroled to.
Right.
I parole you to a rehab. Can you live in a rehab?
No.
Okay. Is there a guarantee that there's going to be a halfway house or some other method that a person can live?
Well, and that's what I'm trying to
The
understand
answer to
here.
that is no.
Right, and
Right?
the
So-
thing I'm trying to
no,
understand here is
I'm not trying to get argumentative.
everybody
The answer
that
to
we
that
send
is
to
no.
treatment from any other county, they're being paroled and they have a home plan. So if they don't have a home plan, they're not getting paroled. They don't go to treatment.
Right.
That's happening in
Which
2
is-
counties.
But my point is, I'm not paroling anybody unless they have a verifiable suitable residence.
Right.
So I don't, when you say we do this in lieu of home plans, we don't do this in lieu of home plans. You need I'll let you go to rehab, right? But Lauren even knows this because we've had this discussion in depth numerous times, and Lauren is great to work with. She knows how I react. Like, I can't parole you to a rehab. You can get furloughed to a rehab, and if it coincides with the release day, which we're having with Tyler Kistner right now, the rehab's probably going to keep him up to his min date, maybe a little bit beyond. So if he has a plan after that, Tyler Kistler, we can parole him at that point because he does have either a halfway house or a recovery house.
But we don't know how long that person's going to be there. And when it comes to our decision about how long a person is appropriate to be in treatment, it's based on the ACM criteria. I don't care how much longer they have on their minimum date. If they completed, they completed. I'm not gonna keep somebody in treatment because they have another 45 days left on their min.
And I'm not arguing with you on that point, and Lauren's cognizant of that, but you made a statement that that's what we do here. We don't do that. So your statement was actually totally erroneous.
Okay.
Okay, so I want to clarify that. I'm not trying to get, again, argumentative with you, but you need to be factually accurate. when you
But
make
then
your
it's still,
statement.
but even if they don't have a home plan, then the furlough is not a good idea because you're gonna disrupt their continuum. of
Okay,
care.
that's a different issue, okay? I'm
And
not-
that's my biggest issue.
Right. However, if they do get furloughed during their jail time, right, and have to come back, right, and just say there is outpatient recommended, correct? That'd be all right, that's a service you can provide at the facility?
Nobody leaves inpatient treatment with a level 1 recommendation. It's either partial hospitalization or IOP. I have never seen in my 27 years working here, anybody recommended to level 1 coming out of inpatient treatment.
Judge, you have something to
Yeah,
say?
if I may, this case that we're referring to with this furlough was my case. I had this individual who was subject to 3 different sentences. one of which I sentenced him on, and I paroled him with the condition that he get a drug and alcohol evaluation and follow treatment recommendations. Second one, he was on bail at the prison, where there was a request to reduce his bail to unsecured so he could be paroled to a facility. Unfortunately, after Lauren did her job, okay, and finding him a bed, I found out that Judge Nanovic had sentenced him on yet a third case and he wasn't getting out anytime soon. So I had the conversation with Lauren that said, we're not gonna do anything with him because he can't go anywhere. Once he finishes his sentence with Judge Nanovic, then we will look to parole him and get him to a rehab after he's out of prison. With the understanding that it was gonna be an unsecured bail situation. On the one case, paroled on the other, provided he has a suitable residence. In the meantime, he files a motion for unsecured bail. I scheduled a hearing. Everything worked out where he had a bed. He was going to be paroled to a bed because he had a home plan, which was to reside with his sister. Between that point in time and the paperwork being prepared to send him, his sister contacted, I think, Chief Holter or somebody in her office and said, where I'm moving to, he can't come with me. So he no longer had a bed, or I'm sorry, he no longer had a viable residence, a verifiable residence to go to, so he could not be paroled. So what we discussed then was, why don't we furlough him? In the meantime, he finds a place to go. And then we at least get his rehab started because he needed rehab. And that's what prompted what I did, issuing the order to furlough him from prison to the rehab on the one case, unsecuring his bail on the other, with the condition that he goes to rehab. That's what prompted this email, I believe, and this whole discussion. I take issue also, Chris, with what you say in that email, because I didn't get it. It was given to me, I didn't get it from you, I got it from Mike, which said that furloughing to treatment is not part of a home plan, because it was never intended to be part of a home plan. The home plan was the residence. Treatment was a condition of his parole and a condition of his unsecured bail. So that was maybe a misunderstanding on your part as to the verbiage, but it was definitely incorrect as the way you wrote that in that email. So I wanted to clarify that. It was never intended to be a home plan.
And Judge,
The home plan was moving him to his sister's residence after he got out of rehab.
when that changed though, then there should have been a discussion about whether or not we should have delayed his admission.
I didn't realize there had to be, because we've done this before. And
In certain case by case, and again, in the email that you have, nothing is 100%. If Lauren has good cause to come to me and say, hey, here's a reason why I think we need to do the furlough, I'm willing to listen to her. And more than likely, I'm going to agree with her, because I'm going to trust her judgment. But when we have a situation where the person was supposed to be paroled, or this is supposed to be a bail modification, now it's becoming a furlough type of situation. We're left in a situation where you're going to have that person coming in. Like I said, that individual is returning back to jail. We have like another person returning back to jail. We have another person who is on a furlough from here. So far, she's been meeting the criteria for further length of stay. But we have situations also where we have facilities trying to stretch, and the one that's returning back, the facility has been trying to stretch ASAM to the point of breaking. And I've told him no more. So he has to go back, because he doesn't meet the criteria anymore. Because they can't even substantiate it other than copying and pasting a review ASAM to me week to week to week. And they were also talking about stepping him down to lower level of care weeks ago. That's my chief concern with this. We are telling people that go to treatment, and then we're sending them back to an environment very potentially that is going to be setting back the recovery by weeks.
I think that is something that needs to be considered in all these cases. But the fact is that matter should be addressed to the courts in fashioning their order, as opposed to an email directive from you to me, the warden, and the Department of Adult Probation, saying that we're not doing any furloughs unless you decide it's okay. which I don't think that's
But
how.
the email said it was, that's not what it said. It said
Yeah.
it was on a case-by-case basis. If you had a
It's-
concern, let me speak, please. So it's on a case-by-case basis, and nobody contacted Chris. Instead, there was a contact to GDAP about an individual case saying, you know, why can't we fund these? So we then had a conference call with DDAP, who basically said it is at the SCA's discretion how they choose to spend their funding. And at that point, Chris said, we're not gonna, this person's in process, we're not going to interrupt that person, we're gonna fund him, because that's not what we're trying to do. We're not trying to limit what we do, but we have a certain amount of money that we can spend to fund people overall across 3 counties, not just Carbon County we're talking about. Our money is not like you got a chunk for Carbon, a chunk for Monroe, and a chunk for Pike, it's all put together. So in that, you know, we get so much funding. In July and August already of this year, we are over budget. We are exploding with people going to inpatient treatment and across the 3 counties. And with it, we have to make decisions what we can, what we cannot. DDAP says we can ask for more money. It's not as simply as saying, I want more money and next week more money arrives, okay?
No,
We can request more money and then it can take a couple months and then there's a whole process to go through that holds up all of our funding till the state then gives us. That's how the politics of it work. I just did ask for more money. I asked for another $100,000 for inpatient treatment. I don't know when I'm gonna get an answer, whether I'm getting that money or not getting that money. That's kind of how our operation works with the funding.
Well, then, and that prompts this question. I mean, I got that email and I saw the funding issue. How long is this issue related to the number of people with furloughs that have to be paid for that created the issue with the finances there? And why wasn't it brought to our attention in the discussion that way? Because like I said, going back to what you had indicated, and I disagree, that's how the email sounded, that it's a case by case, but the final decision rests with Mr. Sorrentino. And that's not how the court system works. Final
But that's how
decisions
our
rest
funding
with the.
works.
That's how
That's
the
the-
final decision for our funding rests with the court, with Chris.
But the final decision on whether to furlough somebody or not furlough somebody under the circumstances is totally within the
Right, that's-
purview of the judges.
That, we're not saying that's not, we're
But
saying
that's
the
not what was
funding.
said in the email. That's not how the
Saying
email was approached.
something.
And then that becomes the issue. Are all the services being provided at the prison? Are all the services under the contract being provided at the prison?
Yes, and in fact, that's why I brought Carolee and Tammy with, because they both can talk about what is provided, how much is provided, who
Well,
is
if
providing.
so everything is being provided under the terms of the agreement.
As far as we're aware, nobody has
Well,
brought anything to our
I mean,
attention
may I-
that there's any problem.
Is there anything that you're aware of that is not being provided?
No, I don't know. That's why I'm asking. Okay?
Can I ask a question about continuum of care? And Mike, you know me well enough to know how I feel about continuum of care for individuals who go to rehab. I don't know, who can answer this question perhaps? It's my understanding that under ASAM that there are various levels of care stepped down from a rehab, including 2.1, which is the intensive outpatient, and 1.0, which is outpatient.
Right.
My understanding, and I didn't know this, and I was never a big proponent of furloughing people either, for the lack of a continuum of care at the prison. I had this discussion with Mike and one of his assistants about how I don't like to do that, but I did it in 2 instances, and one is the one again that prompted this particular email. If a person is assessed at a level of care of 3.5, which is the inpatient, from the prison to a furlough, on a furlough to the inpatient facility, isn't it my understanding that there's then stepped down 1 level, which would be intensive outpatient, and that's best evidence for purposes of treatment?
Well, there's other levels of care in between that. There's
Well, normally it's the
3.1,
IOP.
and then there's the
Right, but I'm just saying,
function. But yeah,
normally
typically
it's
it's IOP.
typically the 2.1.
Wasn't one of these cases that's a Pocono Mountain Recovery Center, they wanted to step down to a
That's it.
residential partial?
Yeah, they wanted him in
But-
partial.
But normally, I mean, that's a lesser used level of care, I think, isn't it?
Yeah,
2.1, the
it's-
intensive outpatient is your primary.
Right.
So, am I correct to say that it's okay, though, that if that level of care is not available, that they could step down to the next level of care? under ASAM criteria?
Again, it's on a case-by-case basis. You know, when we're working
Who would
with
make that
somebody.
decision?
Well, it would be the treatment team that would make that decision. IOP is 9 hours a week,
I understand.
okay? When you have outpatient, they're being seen
Anywhere from 1 to 8 hours a week.
1 to 8 hours a week. So if they were coming to our office here, okay, to our office, if we did not feel that we were doing that person any good by having them at level 1, more than likely they would be told, we're not gonna, you know, we can't work with you
But
on
why
that.
couldn't someone who was in rehab, successfully complete rehab, goes back to the prison, why could they not get a continuum of care of that outpatient if you're only talking about the difference between 8 and 9 hours?
They don't have the opportunity to have the community supports.
But it's something. I mean, I assume that you heard, correct me if I'm wrong, because I didn't hear any of the numbers yet. I assume that when you have individuals assessed at the prison at level 1, outpatient, they're getting the counseling at the prison. What if you have people that are assessed at a level 3.5 but are still in the prison? Are they getting anything at the prison?
Yes.
So I don't understand the difference, why you would counsel them when they haven't gotten the highest level of care they need, but yet those who got the highest level of care they need can't avail themselves of the lower level of care that's available.
They're being seen, but it's still not getting what they need.
But your point that you raised in here was there is no continuum of care. And I, at first, agreed with you until I learned through another email from Mike Greek that there was a contract. I didn't know there was a contract that the commissioners signed for outpatient counseling at the jail. I was not aware of that. So there is a continuum of care. So
It's not, but we're talking about.
it's not the level that it needs to be. I
Exactly.
agree. But it's more than what would otherwise be offered if there wasn't any available for them.
They're getting very minimal, and it's not, the reality is, these folks aren't really getting the help. I mean, they're
But
coming
yet
out of
you're
the
using
jail,
that same service to counsel the same people who need to be in the rehab, so that there's
trying to get them, and a lot of that counseling is about preparing them to when they finally get to the inpatient level of care. We're trying to keep them motivated, we're trying to keep them engaged so that they're ready to go to inpatient. So that level 1 is more about prepping them for their next goal.
But it's the
And I
inappropriate level of
understand
care.
that you feel it's the same thing, but the reality is, when a person finishes inpatient treatment, in most other cases, they're getting referred to the appropriate level of care. And that's an opportunity that they have. Here, in this situation, they're returning back to jail, and they're not getting that.
But doesn't ASAM allow for that step down from IO to
There is nothing in ASAM that says you can move somebody down because
it's not available?
we need to look at, yeah, I mean, in some cases, yes. But it's still, you know, you're putting this person back into an environment that is not conducive to the recovery.
Well, there's a
I mean,
reason,
they can
there's a
see
reason that
Amber
the
once
DA's
a
office
week.
felt it had to be a furlough, that they had to come back to the prison maybe to spend more time in jail because they owed more time yet.
Then why not wait until they're getting ready to hit their minimum?
Because like you said, you want to give them something.
But then we can wait till they go to near their minimum, get them their treatment, and then they can actually do their continuum of care the way it needs to be. I mean, we have individuals that are finishing 3-5, they're not allowed to even step down to halfway house. Because the way the orders are written is they have to go to inpatient treatment at such and such a place. Upon completion, they have to return to jail.
I'll be out with that. It's a truth in sentencing issue, that there's only certain things that would qualify for substitution of prison time. So if you leave somebody out, you run into it, that sentence isn't totally being effectuated. That's part of the problem with that aspect. Lauren, and I'm not blaming Lauren for anything, but Lauren's making the initial recommendation for something.
Correct.
Right, submitting it to whoever, defense counsel and the courts are buying into it, right? And I'm not saying buying into it, they're providing the person with the opportunity to get treatment, correct?
They're getting the
But
treatment.
that recommendation is from Lauren at the facility.
Right.
I guess I don't understand
But when
how
it gets
1.0
enacted-
is sufficient a sufficient substitute for 3.5, but it's not a sufficient substitute for 2.1, coming back into.
Because we don't have a choice, right? We recommend 3.5 and they're not able to go because they haven't hit their minimum or whatever the circumstances are. We're trying to at least offer you some.
Okay,
Because if you
can
follow
I know we can go back and forth, and I'm not trying to, but, you know, sitting here on the outside looking in, obviously there's some communication, whether it be through emails or catch-up that we seem to have. Judge Matika didn't receive a lot of the emails, and I know there had been an email issue there with myself as well. But with that being said, I mean, kind of sitting here, and I don't know how we get to resolve this here today. I don't know what we're looking for. I mean, what I hear there's levels, obviously we can go up and down depending on care. It's a matter of, I think the discussion is with the furloughed and if there's care afterward or services provided. So obviously one side of the room, at least maybe I'm wrong, has a view of how it should be sided and the other side has a view. We're definitely not going to get together as to which is correct or which is not correct. How do we move this forward here, Mike? I mean.
Well, that becomes the issue, because we had a recommendation on a contract to the prison board. The emails that came in were directed to myself, I'm assuming, not as a district attorney, but as the president of the prison board, the warden, the deputy warden, and probation. So it was basically directed in our direction, and it does fall underneath the contract and maybe issues with the May contract, but those were contract issues. Then who does it go in front of in order to resolve what's taken place here? That's why I requested it to come here and copied everybody on the email. But I have a concern that if we're setting something up based on a recommendation, and there are reasons why we're doing a furlough, and the court system is directing a furlough, that ultimately the decision on whether to furlough is falling to Tri-County Drug and Alcohol. That I have an issue with, and I don't think that's covered under the terms of the contract.
The decision in the furlough isn't, but the funding is. We cannot
Well, then-
possibly fund all of these furloughs.
Then I think we
because
need to
people
sit
are
down and
not
determine how we
eligible.
can better fund Tri-County Drug and Alcohol related to these furloughs. But it can't be that we have to get an exception granted by Mr. Sorrentino in order to move forward with what the court has issued in an order.
Right. So what I'm saying is that, we don't determine that piece, but what we determine is whether we can pay for that person to go or not, because when they're on a furlough, they're not eligible for medical assistance. When they are at the release date, Lauren can apply for all of that so that the day they get out, they have medical assistance, and that full funding of treatment does not go on our funding, it then flips over to that.
And we do understand that.
that-
That's why
that
it's
is
not a
the
tactic
main-
that's
that's
used.
a huge
It's
issue.
not like we're furloughing everybody to treatment. That's not happening in every case. But there are occasions where it's
Like
the proper
currently we
thing.
have
So then my question would be here, obviously, we all agree there needs to be furloughs.
We're not
Anybody
saying-
disagree?
we're not-
Okay, we're not saying.
We're just
So we
saying funding
need to
can't
find out how do we
fund.
accomplish the furloughs that the judicial side wants to do, and that the funding would be provided, that there's no questions on this side of the room. That I don't have the answer for sitting right here, because I think it's a much deeper conversation. I don't know, because apparently there's guidelines that have to be followed in order to that, and they may not necessarily be guidelines that you want to follow, and I understand that, because we don't always all agree with how the laws are written. But somewhere along the line, I think for the benefit of everybody here, we have to find a way that we can allow the furloughs to happen as what you need. And I see the point, if you can send somebody out and get the treatment started, that it speeds up the process and the time, and you come back and you're already a step. But then I gotta be honest, I gotta also see the side where, well, if you're coming back into the environment, you weren't getting it, then they just speed the process up too fast. So I think there's both sides of that table, and I don't really, rather than debate both sides of the table, how do we get to the middle of the table here that we can accomplish both of that? Do you, Your Honor, you have any?
Well,
Because I heard you, first there was one, then there was two, then there was three, people.
I'm aware of 3 people that I
Okay.
furloughed.
And that's what-
Which is the one that
5
prompted
currently.
this.
Right, there's currently 5.
Well, I know of 3 that I furloughed.
Okay, so based on a learning curve here, how do we
Well,
get this?
I think with we should have never been having this discussion had it just been requested that we have a discussion in the first place.
Okay,
And I kind of agree that with Mike, that when I read that email from Chris, it sounded like they were giving us a directive on how things were going to progress. I think if we had the discussion, we wouldn't be having this one.
okay.
And maybe we still need to have that. There needs to be stakeholders involved in some type of a meeting that's not going to be in a prison board or a commissioners meeting to
think
discuss
it's-
how we go forward with this.
I think it should, why do we have the CJAB? I thought that was the avenue that we had to collaborate and communicate with what is our policies and how we handle these cases. And I see a lack of communication, misinterpretation of communications,
I don't know if
misunderstanding
CJAB
of
is
what
such a
both
very broad-
parties can and cannot do.
I don't know if we need to go the CJAB route, because that's a very broad group.
It would be, it's a simple resolution between a meeting with somebody from the judiciary, probation, the public defender's office, absolutely. Someone from my office and a representative, or whoever wants to, from Tri-County Drug and Alcohol. But that's not how the email went. And my,
Now-
and my concern was, this is twice now. This is twice where it's a directive that this is what we're gonna do, and it affects the prison board and the commissioners, because you have a contract. And you can't unilaterally change what's in the contract, or do things a different way just by a directive, that's
There's
twice.
nothing that we changed in the contract. Lauren is doing what she's doing.
It's,
Okay, can we arrange to have a meeting of what the district attorney has stated here and bring those?
I'll send out an email and request a meeting.
You have a problem with that, Jamie?
No, I have no problem with that whatsoever.
Your Honor?
I'll go with it.
But I think there has to be something, and if there is a problem with the contract on either side, the commissioners need to be made aware of that and how that can be rectified.
Can I ask which
And I will
contract,
also-
so that
go ahead.
we can review it if we need to? Which contract are you referring to?
I did look at both the annual one and I did have a concern, like I raised in my email about the levy portion of it.
Well,
That's up for us.
well, I've raised that before, I don't think Lauren, what Lauren does under that contract is what we're talking about here.
Right.
What's supposed to do under that contract
Well, we
is
could
what we're
discuss
talking
that
about
at,
here.
Okay.
we discussed that at meeting, that's why we're
But
not.
I would,
Can we
yeah,
take
I would
one,
have no problem.
or obviously there's issues out there, so can we just take one issue at a time and start with the furloughed issue first and how that went out? Are we okay with it, Sheriff? Our solicitor, is that able to be done? Okay.
Attorney, just so I can answer that, there are no levy referrals that have happened at the jail.
And that's because they don't,
Lauren would not be, as the person who supervises Lauren, those referrals, by the time someone gets to the jail, would be coming through the district attorney's office. So at that point in time, that we would forego levy for the most part, because we've already gone beyond that.
Well, that's an issue we could discuss there and ultimately,
I think you
make
need
a
to get-
recommendation, because it wouldn't be, well,
At that point, it would be a
it's
track for it.
because the way we're talking now about the May contract, and that May contract that I had a concern with, because that never came before the prison board, where it probably should have, and that's a matter of.
Yeah, and I do think, and we can discuss, but we could get into all of that. I do know that was before the opioid board also, though. We did discuss that in emails, so there was some issues.
There were some emails, but there was no, I just.
Well, that's why I
assumed
said I
that
think
was-
communication here needs to be better worked out on all sides.
Okay,
So
so
if we
I'll get
can-
an email out and get everybody in on that.
Yes, and then if we can come back with that, and I do think one thing that if anything's come out of funding, we have to figure, because where does the money come from and how does it get funded? And it may not be the way we've always done business, but we're gonna have to change, obviously, that. Sorry to jump in here, I apologize if I overstepped my bounds, but
No, you're good.
we could be here till tomorrow, I'm sure. Thank you. Do you have anything further to say, Jamie, or?
No.
Okay.
Okay, we have to go into executive session.